Can I get a microneedling vampire facial the same week as a lower blepharoplasty? I'd like to have some of the recovery time overlap while I have the time off.
Thank you for your question. You're asking, can you get a vampire facial the same week as a lower eyelid blepharoplasty because you want to overlap the healing processes? And certainly that's a very reasonable question. Just to give you a little bit of background, I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I have been a part of the Vampire Facelift network for several years and a resource for media when it comes to questions about the vampire facelift and, of course, the associated procedure, the vampire facial. So I would ask that in terms of the vampire facial, which just for the explanation is essentially a combination of a microneedling process where similar to use of a derma roller or a microneedle, medical microneedle, to create little openings in the skin to stimulate a certain amount of to stimulate collagen as a response to this fine trauma, and then applying platelet-rich plasma, which is used for wound healing and has remarkable properties to stimulate collagen and improve blood supply and refresh the skin. And the platelet-rich plasma is applied on top. Now, that being said, it seems that from the phrasing of your question that it will not be the doctor who's performing the blepharoplasty who's going to be doing the facial. And I think that's something that is a little bit of a concern for me. And I'll explain why. When you have cosmetic eyelid surgery, at least in our practice, we clean with betadine and topical the whole face, even though we're working just on the eyes, and that's to ensure proper sterility. My concern is if you're going to have the vampire facial done elsewhere prior to the procedure, the skin may still be healing, and there may be a potential for irritation from the use of the topical antibacterial solutions such as betadine or chlorhexidine that's used to sterilize and clean the face before surgery. In our practice, of course, since I do the vampire facelift and the facial, I will routinely, it's comparable to doing a fractional CO2 laser or any other complementary procedure. I'll do both at the same time. I'll do the lower eyelid blepharoplasty and the vampire facelift or vampire facial, whatever other PRP-related treatment is appropriate at the same time. So there's a true overlap with the procedure and not the risk of any irritation. So you may want to discuss this with your doctor before, if your doctor isn't going to be performing that vampire facial procedure, about doing that. Where if someone else is going to do the facial beforehand, how many days before that can you do, would they be comfortable with? Understand that the deeper the needle goes in the microneedling aspect, the longer the healing process and the more time that it would be appropriate to wait so that the skin heals over well enough that the use of any topical antibacterial will not be irritating and take away from the benefit of the procedure. So again, ideally, I feel like the way we do it, I would do both procedures concurrently, but discuss this with your doctor if it can't be done at the same time. So I hope that was helpful. I wish you the best of luck, and thank you for your question.